Welcome, folks, to another Black History Month event. Here we have from Boston hip hop to community equity work at Mass General Hospital with Cindy Diggs, Leah Gordon, Dan Chonde, and moderated by Efren Flores. Just a quick disclaimer, views expressed by the speakers and workshop facilitators do not necessarily reflect the views or opinions of the organizing groups. All programming uses the Zoom meeting or Zoom webinar format. The webinar format is to prevent unexpected interruptions. It's not that we don't want to hear your voices. In fact, we certainly do. Questions for speakers can be submitted using the question and answer chat function in Zoom. As always, we'd like to thank the Black Project, that's the Black Literacy and Arts Collaborative, for their incredible support of this programming and organizing the website, as well as the flyers. The Black Literacy and Arts Collaborative is a Boston-based nonprofit which supports resources for literacy and arts in communities of color. They have mentorship programs, storytelling to build medical trust, and a Spread the Love program, which is an amazing program where they bring together strangers to share messages of kindness, as well as book giveaways. You can learn more about the Black Project at their website, theblackproject.org. Similarly, this programming was organized by the People's Heart. It's a healthcare institution and community art and placemaking collaboration. The mission is to change institutional healthcare culture and empower underserved patients and communities of color through art and design. Programs include art on walls, workshop, lectures, pop-up health events. You can learn more about the People's Heart at their website, thepeoplesheart.org. And without further ado.
And people definitely, so a welcome environment, so always open doors here. So welcome everyone. My name is Efren Flores. I'm an associate chair for equity, inclusion, and community health for the Department of Radiology. And I'm also one of the community the clinical community liaisons for the MGH equity office for Dr. Betancourt and the equity team. And I want to welcome everyone for to the presentation or discussion, I would say more so like a fireside chat entitled From Boston Hip Hop to Community Health Equity Work at MGH, presented by the MGH Radiology Diversity, Equity, and Inclusion in collaboration with the MGH equity team. I would like to, we can move to the next slide. We're going to be recording the presentation just for everyone's, give more flexibility later on. So first, we have the honor of having this incredible invited speaker who are truly inspirational for me and many others in the work that they do on a daily basis. We're going to start with Cindy Diggs, who is a Community and Cultural Engagement Manager, Center for Community Health Improvement, Mass General Hospital, and I would say unofficial mayor of Novian Square, Roxbury, and everyone, because she's an incredible advocate and she's always there and very well known in the community as well. We have Leah Gordon, who's the Diversity Director for Patient Care Services Center for Diversity and Inclusion at MGH, who's doing incredible work, and they're both going to share a little bit more of that background and journey from hip hop to equity work that has been incredible in terms of the trust building and longitudinal relationships in the community, which are truly key for us to be effective in this work. And then Dr. Dan Chonde, who is Executive Director for People's Heart, colleague, radiologist, and incredible source of also inspiration with new ideas, but also making all our care more accessible, particularly our care spaces as we at the intersection of innovation, art, equity, and empathy. And with that, if we can move on to the next slide, just to give a quick overview of the conversation today. Talking about Cindy Diggs, how she started her professional life as a Boston club promoter in the 90s, and in response to a rise in violence in the community and other health pressing issues, had the idea of promoting anti-violence work through hip hop. But what developed into that, it also merged into more like her community advocacy in social determinants of health, and really at the intersection of hip hop, anti-violence, and pressing health issues in the community. And the conversation will include Leah, who met Cindy as a hip hop journalist, and now this is like incredible work that informs Leah's current work, and became one of the many people impacted by Cindy activism. And then both of them actually pursue a career in healthcare, and MGH and the important work in the community brought them together, and collaborating closely with the Equity Office, with the CDI, and also with the People's Heart Project. I just want to say a quick anecdote, and then I'll leave it up to you, Cindy, Leah, and Dan. Is that the conversation, how everything started when we're doing some of the community outreach events, and I was talking with Cindy about potential expansion into tropical foods, like the Latino grocery store in close to Nubian Square. Maybe doing like a coquito takeover there, and talking about how from expanding that and highlighting one of the local stores, but also using that as a health hub to talk about promoting healthy eating and living in the community as well. And from that conversation, that evolved into listening to Cindy talk about her journey in throughout the years in the community, from her work in the 90s, but more so just how this work is very important in the community to ensure that they have creating opportunities for all the community that are there, not only health opportunity, but also for the small businesses to continue and their critical work in the community. And that led into talking with Cindy about, like, I would love for the MGH community to benefit from listening to this, because I believe in the power of storytelling, and this is such an important narrative of what it takes and what is needed for us to take here, and the important work that Cindy has been doing and continues to do now with Lee and Dan. That happens in the background, many of us don't know, and this is an incredible opportunity for us to and to have an inside look into that, and also have a better understanding and learn from their experiences. So with that, I'll lead up to Cindy to take it from here.
Thank you, Efren. So I think, when I think of Black history, I think of all of the things that have impacted my life and how I got to be this person who's known as Mother Hip Hop in Boston. And it really starts way back in the late 70s, early 80s, when hip hop was born. So I was born before hip hop. And I always think that if the teenagers from my era didn't like the music, like, where would it be? And I had a brother who used to break dance along with his friends, and I knew Lino Delgado, who was the founder of the Floor Lords, which is the oldest running breakdance crew in Boston, and he's now in Hawaii. But all of those things, I had no idea that they would have an impact on the work that I was doing years later. So if I go past college, I mean, obviously before that, we went to different parties that featured hip hop. So if you look at this picture right here on the far right with Run DMC, that was an event that I hosted with the DJs for Peace for the Jam Master Jay Foundation. But back in the early 80s, 1982 or 83, when I was in high school, I got to see Run DMC do their promotional show, which is like their first shows as they get ready to come out. And that was at Dance Factory when I was a kid. So to think that, I would years later be working with Jam Master Jay and having him at an event that I did, and rest in peace to him, we put this event together in his honor back in 2009. But I'll say, when I graduated from college, I went to work at Jamaica Plain Legal Services, and this is really where I think my health component and hip hop really started. I was an interpreter. I majored in Spanish in college, and as the extra person on staff, I was oftentimes asked to serve as a witness for the young people who unfortunately were there to sign their wills during the beginning of the HIV epidemic. And so, that was a really, really hard thing for me to do. I was only about 22 years old, and just to see people my own age having to sign their wills was just very, very sad. And so years later, I'd say about 10 years later, I became a nightclub promoter because I'd always liked planning events, and my brother-in-law and his friends started a club, and they were all cops and firemen, and they really didn't know anything about event planning, so they asked me to join them. And just keeping that thought of those young people with HIV in the 80s at the forefront of my mind, I went to the Boston Public Health Commission and got condoms, and was probably one of the first people to distribute condoms in nightclubs, and Black nightclubs anyway, during the early 90s. And then a couple of years later, I branched out on my own to run my own club along with a partner. And at this time, it was very dangerous in the club scenes. It was at a time when the people that came out to the clubs were in gangs a lot of those times. And I decided that I was gonna stop in the club business and start a hip hop organization called UMMF, and it stands for Us Making Moves Forever. And that's when I met Leah, when she was a young version of herself, and she was a hip hop journalist. So that's the tie-in there. Yes, Ms. Waddy. Luckily, I knew them, so they didn't act up at my club as much as they would others. You can see what I'm talking about in the chat. But I wrote a newsletter and gave it out to the people that attended the club, and it talked about how we needed to get along with one another. And so I think that was the beginning of my violence prevention work, which is what I have been working on for the past 16 or 17 years. But I didn't know at that time that I was providing alternatives to violence by holding meetings at the Playtime Barbershop in Nubian Square, right across the street from the station where I'm at all the time. We would hold meetings there to get ready for our big shows. I used to put on a huge music conference, and as I mentioned earlier, Jam Master Jay was one of our keynote speakers the second year there. And afterwards, you know, I stopped working in the entertainment industry and started working with teenagers back in 2000. And that's when I started the work with HIV prevention, STD prevention, and teen pregnancy prevention. And because I had such a great relationship with the members of the hip hop community, I was able to work with the young people there and create the Hip Hop for Health campaign for the Boston Public Health Commission. And that was used to get young people to use the services of their school-based health centers. And it was like a roundabout way that we had to introduce them to HIV prevention, because anyone who works with kids knows that no one wants us to talk about sexuality in the schools. But that was the way that we did it. And it was a flashy flyer that looked like a club flyer, and on the back it had the stats of that time, and it said 1 in 7 of your friends has an STD. So we passed those out the same way we did music. I was a street promoter also with the record label, so I used those same strategies. I didn't know that it was called outreach. It was street promotions for us, and that's how I was able to get into the places that most people who did outreach couldn't get into. I was able to drop off those flyers at the hair salons and the barber shops and record stores at that time. And then fast forward probably about 10 years later, I was the wellness manager at Whittier Street Health Center, and that was at the beginning of the youth violence epidemic. So here we go again. You know, back in the 90s, I wasn't really paying attention to it because we were living it. But now that it was younger people that were getting killed, we really need to do something about that. So some of you all know that MGH has a show on the Java with Jimmy show. It's called Your Healthy Java. And James was the person that introduced me to the Louis D. Brown Peace Institute. And I had never heard of them before. And so I figured if a person that had been involved in community for probably 20 years at that time, if I didn't know them, then there were other people that didn't. So I created the concept of the Start Peace t-shirt with the local hip hop designer, Antonio Ansaldi, at a time that Mayor Menino wanted the Stop Snitching shirt off of this shelf. And so what we thought was gonna be a one-day vigil that we hosted back in 2005 to talk about this t-shirt turned into a movement called Peace Boston. And if you see the first photo there, that is a picture of me and Big CEO Red from Team 220, and we co-produced the Peace in the Streets album. And we used that to raise money to give to the Peace Institute towards a burial fund. And that was probably one of the most difficult things that I've ever had to do. But we also used it for youth programming. And we would later go on to produce the Got Peace basketball tournament and a number of other things. So when you think about the ways that people think about hip hop and the negativity that they'd like to connect it with, I think that we really need to continue to educate people to let them know that hip hop was created to stop gang violence. And it was started by gang members. The Black Spades would later become the Universal Zulu Nation. And we've done a lot of work utilizing the culture and the music to spread messages about health issues. And if you can imagine over 1,000 people wearing this Start Peace t-shirt, and these were like hardcore dudes who, you know, would never be talking about peace, but that album has over 100 artists on it. And they, in previous times, some of them may have been drug dealers or they might have been carrying guns, but then they were the ones to promote peace and they led by example for the young people. So that's my work, and my life story was really to be an inspiration, and I had no idea that this would continue to happen. Like, I still have them reaching out to me and they're all in their 40s now. And I just know from listening to them that I helped to save a lot of lives. So I'd like to pass it on to my hip hop daughter and colleague, Leah Gordon.
Thank you, Cindy. Wow. Every time I hear you talk about your history here in Boston, it really does make me feel very honored to be connected to you and to know you, to call you a friend and a colleague, and honestly, to be part of the same team with you here at Mass General is a dream come true. We were rooting for each other to get to this point, and to get to this point together, to be on the same team with Cindy is beyond an honor. I grew up in a house where music was thought of and utilized as a great healer. And my dad, who worked in public health, at one time was a commandant of the soldiers' home. We just constantly had music in our house and just were exposed to music. And I remember right before he passed away, hip hop was really kind of becoming a thing in our home between myself and my brother. And he kind of didn't get it and kind of didn't appreciate it as much. And then, you know, after he passed away, it really did become for me the thing that was a healing agent. And, you know, I have had this great appreciation for hip hop music and poetry, something that also my father and myself were very much involved in. So just feel like this very spiritual connection with music. And at a point where I was able to start to go to live music shows, I was engaging with a lot of the local hip hop artists here in Boston, and oftentimes would just be thinking about and talking about these shows and these artists and their chemistry with the audience and their chemistry on stage. And somebody said to me, you know, you really should think about writing this. And so I ended up finding this paper here in Boston called What's Up. It was a paper that was just looking for writers. They actually advertised on WERS back in the day. And it was a paper that was actually dispensed by homeless individuals, and a large profit of the money we would make off of these What's Up magazines would go towards homeless organizations. As a matter of fact, to the original Haley House down in the South End, before there's one in Nubian Square now. Yeah, right. So I started writing for What's Up magazine and just going to all these amazing shows, and actually got to meet like really wonderful people who I idolize. Ed O.G. here from Boston, good friends of mine, Acrobatic and Mr. Liff, who I'm still very good friends with to this day, but also had the opportunity to interview Eminem when the Marshall Mathers album was coming out. So before he was at the Super Bowl. Eve, who was, I think she was on The Talk or one of those daytime shows. She's off of it now because she just had a baby. Bahamadia, Pharoah Monch, all these like amazing artists. I got to interview them before their shows. And, you know, at some point I was thinking, you know, I'd like to go beyond writing for this local magazine, and really envisioned myself writing for The Source or Vibe, and just never really got that break. And you know, Cindy talks about teenage pregnancy. Well, I was a teenage mom. I became a mom at the age of 19. For me to go to these shows, I had to really twist my mom's arm to babysit so I could go to the shows. And, you know, I would bump into Cindy at these shows, and, you know, I'd be like, looking at this lady handing out condoms and flyers about, you know, gun violence prevention and youth pregnancy and STDs. And I'd be thinking, man, she's really crapping the role here. We're like trying to have a good time, and she's all with the health promotion in our faces. And again, you know, like Cindy said, it wasn't really called health promotion. We were just kind of like, she's promoting the party and she's promoting the health event. And, you know, it wasn't until like years later when I realized that my career as a music journalist was not going to pay for my lifestyle as a mom and just as a person in the world, and then I chose nursing because a mentor said to me, you know, I see these qualities in you, and I chose this path. Somebody called it the snail trail, but I think it's the trail of courage, where I got my associates and then my bachelor's and then my master's and then my doctorate. And it took 16 years for that to happen. My daughter it has her MBA, and she got hers in 2020. And I got my doctoral degree around the same time. So we both graduated college at the same time, and different levels of college. But I said to her, nobody would have bet on us because, you know, again, 19 years old with a kid and these aspirations of trying to find a way to make music a priority and a career and a livelihood, you know, just wasn't necessarily going to gel. But I recall, you know, and I don't know if Cindy remembers this, but multiple times along the way, her just cheering me on in you know, trying to figure out what I was going to do as a kid and get to this point. And it wasn't really until I was able to reflect, maybe even a little more recently, that Cindy actually taught me that you can still be your full authentic self, your hip hop loving self, and do what you want to do in healthcare, and find ways for that to merge. And so for me, one of the things that's really important, and where I find commonality with Cindy and connection and kindredship with Cindy is our commitment to community, because my story, my personal story, is laced with a lot of the elements that Cindy was trying to make our community aware of. Youth pregnancy, you know, thinking about who you're sharing yourself with and being safe in how you're sharing yourself with somebody. And she really helped me understand that I could be somebody who is important in healthcare, even working in academic hospitals that might not always be taking care of community, but staying consistent as a voice of needing to be connected with community in what we do. And you know, I really feel like I probably would not have been able to, in my mind and in my heart, merge those two worlds had I not seen Cindy Diggs do the work that she has done for all these years. And again, you know, as I was interviewing for this position, as she was interviewing for her position, we were just cheering each other on and just sending texts to one another about, wouldn't it be amazing if we both got onto the same team and we could work together? And you know, I am so glad that I connected with Cindy as a young person and that we worked together in this space together, because we then, you know, come in contact with, you know, our brethren in terms of love of arts and community, Dr. Dan Chonde, who really has, I think, in my personal opinion, I don't want to speak for Cindy, but has ignited a passion for how we can truly make the arts and health literally merge together, with community at the center of that merge and being together. Because as Cindy said, the hip hop music came out of struggle for community, whether it was around gun violence, whether it was around seeing drugs in community, whatever it was, the healing for our community, for Black and Brown communities, was and is and remains hip hop music and the arts, you know. So thinking about like the last poets who are very instrumental in influencing hip hop and artistic work, Gil Scott-Heron, and then, you know, fast forwarded to Ed O.G.'s and Tribe Called Quest and Brand Nubians, fast forwarded even further to Kendrick Lamar's and things like that. We can see ourselves in that music. We can see our struggles in that music. We can see our struggles in the art that came with the pictorial art that comes along with being part of hip hop community, because hip hop is really encompassing breakdancing, graffiti art, and the music itself, you know, DJing and MCing. And that history of our knowledge of community and then our passion for the arts and music really comes together really nicely with the three of us coming together and really having this very tight connection about really wanting, you know, us as individuals, as well as the organization that we work for, to help rise to the occasion to help these worlds merge nicely together, because we know it's possible. When you think about music and community and the arts, that's all merging together. Why not drop that healthcare piece in, which is only going to help community survive and thrive in ways that we know and have always wanted to have for our community. So I'm going to pass it on to Dan, who again, you know, we are so appreciative of and really enjoy working with and feeling connected with in terms of this work and commitment to arts and the community.
Awesome. Thank you so much. It's funny because I remember the first time I met Leah and Cindy, and I was trying to pitch them this idea on doing community programming for Black History Month. And, you know, it was COVID, everyone was on Zoom. There were all of these calls from kind of across the US of performative diversity efforts, you know, those diversity efforts where you know, like Skittles released a statement, Gushers released a statement about how Gushers and Fruit by the Foot were going to fight injustice, right? So there's all these like ridiculous things. And here I am trying to pitch this idea of a community inclusive Black History Month. And so I met with Cindy, Leah, and Deb Washington. I have never felt so small as they stared me down and tried to suss me out. But I think one thing that I've really been able to add to this, to all these great voices, is not necessarily that I'm a great voice or, you know, a great teacher or sage, but you can always count on me to say exactly what I think about who, and not be afraid to, you know, use that bravado. And the fact that I have the MD after my name, for whatever reason, we live in this unfortunate society where people care about that. So, you know, that's really what I bring to the table. But so I have a couple slides, right? And so, you know, we think about Black history, we think about diversity, equity, and inclusion, all this stuff. And, you know, we think it's this glamorous thing. Here's Martin Luther King, right? But truth be told, it's nothing like this, right? In your time, they hate you, they despise you, they try to discredit you. And then once you die, maybe they whitewash it all and make you the patron saint of Black people, right? That's the hope, or I guess the unfortunate truth of it all. Now, right, this is Martin Luther King. Maybe he's, you know, an OG, right? We think about these guys as well, right? This is NWA, hated in their time. This is them on tour, 1989, Dr. Dre, MC Ren, Ice Cube, right? This is before they went to Detroit, where they played after the police stormed in, threw some firecrackers, got everyone out of there. These guys ran out the back and they got whooped by the police, okay? This is 1989. Fast forward 2015. Here we have the son of Ice Cube playing Ice Cube in an Oscar-nominated movie about the legacy of these people, right? So this is how things change. We as Black people, we struggle, we persist, we eventually overcome, right? Now, obviously, I'm not as great as NWA nor Martin Luther King, but I do find it immensely enjoyable when I get my own trolls and critics. Here's some interventional radiology troll calling me out for my co-residents, you know, not having a favorable opinion of me because apparently I have a non-collegial performance and I should stop spending my time doing this diversity work and focus more on pleasing my co-residents, right? I happen to actually enjoy this, right? I love the work I do because it's all about community. This is the world we live in, right? Us in the hospital, us as doctors, as nurses, as technologists, as varying levels of administration in the hospital. We have these blinders on and we come to work from wherever it is we live. Maybe we live outside of Boston, maybe we live in nice, you know, suburbs in our nice houses. We come in, we put on our blinders, we put in our hours, we collect our paychecks, we go home and we spend it on hours, right? We're not thinking about the people that make up this city. We're not really thinking about our patients and the communities that our patients come from, because we're in it for ourselves. And, you know, that's kind of like human nature. It's made worse by the fact that many of us are transients, right? We're not from here. Maybe we're not going to stay here. We're coming in, doing what we got to do, and then we're piecing out, right? Maybe we can't, maybe if you're a doctor, you can't name 2 technologists that you work with, right? Maybe if you're a technologist or a nurse, you can't name, you know, 1 resident, or you can't, or no one knows the names of any of our staff who transport patients. One of the amazing things is when you see Efren knows everybody. He has connections with them. He knows their names. He'll stop, he'll talk, he'll say hello. No matter where you are in the spectrum of authority or on this hierarchy, he will stop and he will make you feel seen and he will have a conversation with you. That's what we need. We need to remove these blinders and have those connections with people. Now, we talk, like, my interest is having challenging conversations with folks, getting people to acknowledge, 1, we're really bad at being empathetic to other groups, but 2,
our history in and of itself is really tough to deal with. It's a history of slavery, it's a history of marginalization, it's a history of discrimination. But just because that's our history, it doesn't mean that needs to be our tomorrow. So here's this poet, also a Boston guy, musician, Reggie Gibson, right? I think our problem as Americans is that we hate history. What we love is nostalgia. We love to remember things exactly the way they didn't happen. History itself is often an indictment, and people, we hate to be indicted, right? One of the issues with COVID is we hate that we had to face all of these injustices, both racial, socioeconomic, the fact that huge swaths of the female population had to leave the workforce to take care of kids because we have these gender norms. There's just a lot of unfortunate truths we had to acknowledge. And now we're at a place where we need to move on beyond, we need to move beyond that. Doing that is tough, right? It's much easier for us to just throw something on our Facebook page or remove our picture from our Twitter profile for a week to celebrate Black history or something like that. But that's not what I'm trying to get you to do. I'm trying to get you to actually connect, right? Become one with the community, move on beyond yourself, and find love and appreciation in those people around you, both in a workforce, but even broader in the city of Boston and beyond. Now, we're thinking about, so we have this United Against Racism campaign, right? George Floyd is murdered, everything's racism, 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 we need to stop racism. Forget all other types of discrimination, right? Racism is the answer. Racism is the disease we need to stop. We can take a pause on sexism, we can take a pause on gender identity and discrimination against people with non-heterosexual sexual preferences, right? It's just racism. And how do we deal with racism as society as a whole, right? We blame other people. Here's another institution. They have this attention, visitors, and patients, right? This healthcare system is a healing environment. Aggressive behavior will not be tolerated, right? And then they go on to say it is the patients and their families who are the ones perpetuating racism. Forget that the managers of some of these staff haven't hired Black managers or Black assistant managers ever and continue to perpetuate these levels of racism. Really, if we're going to focus on discrimination, we got to think it's someone else. And that's unfortunate, right? Because many times it's us, it's what we as a system allow to perpetuate. And if we can't kind of heal ourselves and make those changes to our internal systems, there's no way that we can hope to reflect the diverse values of our patient populations and actually engage with them in meaningful dialogue. So you probably all know Melina Cass Boulevard, right? What do you call it? You probably call it Mass and Cass, right? We know Mass and Cass, Mass and Cass, Mass and Cass. Homeless people on Mass and Cass, right? Well, first, they're individuals experiencing homelessness. They're not homeless people because they're people first. Despite that, right? Melina Cass Boulevard was important in the news before the Mass and Cass debate. So the city of Boston wanted to knock down all of these trees in order to expand the highway, put in bike lanes, et cetera, right? What people don't understand is that Roxbury is a heat island. That means it's a neighborhood where it has like super high temperatures, and it has these high temperatures because there's already so little trees, and the loss of the urban canopy leads to heating, leads to poorer air quality, which then leads to issues of asthma and other respiratory disease, right? So we can draw a line. Of course, here's some images of Melina Cass Boulevard and some people trying to save it. We can draw a line between the historically redlined districts of the United States. These were areas in the early turn of the century where they kept Black and brown people in. So we can draw a line between the heat environments, so these heat islands, and these red line districts. It looks like this isn't actually going to play for me, unfortunately. Oh, here we go. Perfect. So here's a map of the historical redlining districts of Atlanta, and here's a heat island map. And as you can see, these actually literally one-to-one match up. So what we have, there is scientific studies that have demonstrated that Black and brown populations have a higher likelihood of residing in heat islands, right? Which leads to poor air quality, which leads to respiratory disease, et cetera, et cetera, et cetera. Now you'd say, oh, well, that's because typically Black and brown populations poor people live in heat islands. That's not true, right? National survey, despite the Black population only making up 10% of those below the poverty line in these areas, 75% of Black Americans resided in these heat islands in the surveyed cities. Now, you know, it's very easy for us to kind of devoid ourselves from these things and think like, well, that's someone else is going to deal with it, right? Someone else, it's someone else's job, right? My job is taking care of me, and it's taking care of, you know, whatever I consider my little microcosm. I'm a proponent of intersectional diversity. Intersectional diversity means we all are part of everything, right? This is something called an inclusion wheel. On the inside are factors that one can't really change about themselves. On the outside are factors that people can change about themselves. Everyone exists on a spectrum for each of these, a spectrum of privilege versus discrimination, right? Age, we discriminate against the elderly, right? Not even elderly, but we have age-based discrimination. We have race-based discrimination. We have discrimination of genders. There are instances where we discriminate against veterans, where we discriminate against, you know, those with a certain degree and those who don't have that high level degree. So everyone is kind of a combination of all of these unique identities existing on this spectrum. And we tend to just focus on a single thing like race. And then tomorrow we'll focus on gender. And then, you know, we'll never focus on age because age discrimination is one of those things we just allow to perpetuate forever. But what we need to be doing is looking at all of these conversations together simultaneously in an intersectional framework. And so that's what we do with art, right? I showed you before the poster at another healthcare institution, which seemed to be very aggressive in blaming patients for their behavior. Instead, what we try to do with the People's Heart is use art as a way to instill empathy in people. And of course, there's a whole scientific explanation for how art can build empathy and how empathy is networked into your brains. But you can find that yourself in one of our many talks online. But I want to throw this over to the conversation between the three of us so we can, you know, maybe come to find some deeper understanding for all of you.
Wow. I mean, I have to say, like, Dan, Cindy, Leah, this has been like, I mean, every time I talk to you guys individually, it's just incredible. I always learn, but it's also just, your words are very impactful, but more importantly, just now, again, just another special moment that everybody has the opportunity to listen to you. And I'm sure a lot of people have a lot of questions. The more than I'm probably gonna fade into the background because you guys are the stars of the show. More importantly, when I listen to you every time, not only now, but every time we have a conversation, everything is just so authentic, right? The caring part is palpable. How your perspective and your history, in terms of like personal history, fuels your current work, and how you all came together into this, and such a nice and cohesive story. And I have to say, very few places will have the opportunity for us to come together and share this moment. And so I just want to say thank you really for taking the time today and for sharing this. And if there's any particular question from the audience, please go ahead. I'm just gonna fade into background. You'll listen, because this is, it can keep going and going and going and going. So if anybody has a particular question, please, if they want to unmute themselves or raise your hand. So yeah, I see one question from Wanda Cox. It says, like, all of you are so impressive and inspiring. Wanda, if you want to ask her yourself, it's totally fine. Say, what kind of barriers do you face with doing your work, and what can someone like me do to help?
Yep, that's pretty much it. I'm wondering, as I'm sitting here listening to you, you all are such an impressive force. Someone like me, not quite impressive in this regards. I'm wondering, what can I do to pitch in to help?
Well, we always need volunteers, and thanks for joining us, Wanda. We went to college together and we listened to Eric B. as president on the VU campus. But yeah, we always need volunteers because we're putting on these big events in the community in Nubian Square, and that's always the thing that we don't have enough of because it's new to the work of MGH, that we're out in these spaces, and a lot of times the staff that come with us are manning their resource tables and that sort of thing, but we always need people that can help us to do more in the community. I know that when I first started bringing MGH there, I got a bunch of my friends to come and serve as tour guides to show the nurses and doctors where the different stores were and different places that they could go to eat. So, I mean, if you wanted to reach out with your contact information, we could start volunteer opportunities, and I post a lot of it on Facebook, so anyone else who'd like to join. Otherwise, my email addresses will be in the I'll put it in the chat. Actually, that'd probably be a better way.
Moving beyond that, everyone has something they're good at, right? You haven't made it to this point in your life without being good at least one thing. And you can use that one thing to help the community, right? So one thing we had during COVID is there were so many Black-owned businesses that were closing because they were under-resourced, they didn't have certain technical skills. I think between like July and April of 2020, 40% of those businesses that closed were Black-owned businesses. And so here's the thing, right? Some of these businesses have simple things like they don't have the technical skills or the money to build a website. So if you can build a website, you can help, right? You can be part of the change. There's a bunch of places in, Nubian Square, Mattapan, Dorchester, where they just need help with things, right? There's a number of organizations like the Urban Farming Institute out of Mattapan, where they're working on creating sustainable produce for the communities. You can use your time, you can use your monies, you can use your connections to kind of engage with these groups, highlight the work that they do, and then, help the communities help themselves.
Oh yeah,
I wanted to take a stab at Ruby's question about imparting CRT into discussions about dispelling misinformation. And, one of the things I feel like we do at Mass General through what was formerly known as the 10-point plan out of Dr. Betancourt's space and some of the United Against Racism work is, looking at racialized medicine. So I actually am the advisor of our our PCS collaborative governance group on diversity and inclusion, and the pharmacy just took red man syndrome out of their formulary as a like a term to use for a reaction to a medication. It's to a specific medication because they said that, you know, there's a lot of racial connotation to that. And when I asked the young lady who was in the collaborative governance, so, you know, what is the new term for it? And I think she said vancomycin skin reaction. You know, like it's literally called what it is based on the drug that causes the reaction rather than calling it red man syndrome. So, you know, I think there are ways that we can look at, you know, I know we're talking about the BUN and kidney function, and you know, there's a comment that used to come up when you would order that lab that would say, consider that this is 25 points above if it's an African-American person, and now it doesn't say that anymore. That's changed. So there are ways, at least in healthcare, that we're just addressing this racialized medicine. We are doing that through MGB as well as MGH. So to me, that's the way we do it in medicine. You know, in terms of like other dialogue, we are using you know, Dr. Kamara Jones' allegories around stepping stones and talking about race and racism in very authentic ways, and really talking about how it impacts us and saps the entire system. So we're really making it more inclusive, that it's not just people of color's problem, but it's everybody's problem. So to me, I like the sort of subtle ways that we unpack this, because if you start using things, which to me, you know, CRT is really just about, let's be accurate about how we're conveying our history in any kind of space. And then that ends up getting people charged. When we do this in a sort of subtle way, and we make it more of an everybody's issue rather than it's this group's issue, that group's issue, and get everybody feeling invested in addressing and talking about the issues, then I think that's a kind of like the way to integrate this into the conversation, and not necessarily start off on something that's going to get people all charged up and worked up, when at the end of the day, you can be as charged up and worked up as you want. We still have a problem here that we need to address. And I hear what you're saying, Dan, on the racism piece, and how it's such a centralized focus. I kind of feel like we're a little overdue in talking about it as a centralized focus. So I'm all about talking about it as a centralized focus, just because there has been movement in other, you know, there's been movement, like this women's soccer team, they got pay equity. That's a big thing. So there has been movement when it comes to like women's movement, and there's certainly been movement in other areas of isms, but I feel like the biggest ism is racism. And once we really tackle that in a better way, all the other things will fall into place. Like even a lot of folks will say Dr. King's work would not, it's the basis for, you know, women advocacy, LGBTQ advocacy, and changes that have been able to take place a little bit easier in those spaces. So I think there's ways that we are talking about CRT without calling it CRT, because we actually in healthcare have to address these disparities and these inequities so that we are on an even playing field when it comes to the care that we provide everybody.
You know, building off of that, it's not that I'm not excited that
I know.
is a central thing, right? Because I love to talk about race, because
Yes.
a lot of these issues are race-based. What my eventual concern is that we move on to the next thing, and we shouldn't have to move on to the next thing.
You're right.
With all of these conversations at once. You know, I always say this, right? Whenever I'm talking about a race-based thing, if there's a group of people who's had it quite possibly the worst of any of us, even though, you know, it's not a game of numbers, it's the Native American populations, right? We have genocide, we've driven them to the brink of extinction, we've put them on lands that, you know, they did not previously use, we've changed their diets, leading to, you know, incredible rates of obesity and health disease. And we, you know, they're never going to get their fair shake because there's not a quorum enough for us to care about them. And, you know, when it gets to the point of, you know, we're not going to call that Washington team, right? We're going to change the name of the team. People are like, cool, finish that problem. Now let's get back to, you know, the monolithic Asian group that we just call Asians and how they're discriminated against, right? There's so many.
I agree with you, Dan, because I actually feel like when you work in healthcare, being able to focus on many things at once is literally an expectation of every single one of us, whether you're a clinician or not. So why focus on one over the other when we should be focusing on them all? And I hear that 100%.
I would say, just really quickly, Leah's very thoughtful and organized, so she doesn't like to, you know, talk about things before they're fully baked. But she has this amazing idea for what healthcare can look like in the future, right? We should always be pushing the boundaries. And, you know, she has this great idea for a community, like a truly community-based pop-up style health event, which uses community and traditional practitioners as well as us Western medicine, big hospital folks. And, you know, this is what we need to have our communities demand now, because this is our opportunity to make real change.
So I think that ties in with one of the projects that we're working on with the People's Heart, and it's called Black 365, so that we're not pigeonholing these celebrations that we have. So, I mean, I'm not just Black in February. I know Efren and Carmen are not just, and Leah are not just Latino in September. And gay people are not gay in June. So we've got to start incorporating these things all year long and working on things that are outside of the box to most people, but you know, it's just normal for us. It's something that I asked when I first came into this field. Why am I talking about HIV and STD prevention separately and teen pregnancy prevention separately? You're getting all of them through sex. And they looked at me like I was crazy, but that's the way the funding would come in. And so we've got to start thinking outside of those boxes and start doing the things that need to be done just because they need to be done. That's the way that I did it. I had no idea I was doing violence prevention or STD prevention. I was just doing what needed to be done.
It's funny
without a budget or, you know, doing it myself.
It's funny that you mentioned funding, right? Because someone had asked, like, what's the biggest obstacle you face? And it's always funding, right? We could do so many great things if we could get just a little taste of the funding to create that. I mean, we created a whole week of Black History Month programming out of like $3,000.
Well, that's what I think really is, you know, the culmination of us three is it's by connection and then more connection and more connection. We end up finding how to make, lemonade out of lemons. And I think that that's sort of a tagline for all diverse communities that have come against really challenging times, specifically within healthcare. And so, you know, I think that this is a really great time for us to come together and merge and through community within ourselves here as community to really create and accomplish great things for community.
And I think that one of the things that, as you know, we've come to the hour, and I think that we'll take more and more time to unpack, and I really had to be continued for sure. But you know, a few things that really highlight from this conversation is the power of building up the community, right? So how people come together and support each other, because you don't have to do it alone, right? So we may have some idea, or we may have some uncertainty of how to get involved or what we can do, but there's a lot of people that also, you know, are interested in this space, and we have to support each other in order for us to make that meaningful change, where it could be deleting red man syndrome, or even like, for example, your words matter. So what Dan was talking about, people experiencing homelessness, right? And changing, because people are first. So the way that we talk about our patients, the way that we approach our communities and each other, it's a powerful step in the right direction, and many steps in the right direction will take us to that sustainable progress that we're all aiming for. So with that, I just want to say thank you for everyone for joining us. Special thanks to Carmen to help us here, and all the credit, and all special thanks to Dan, Leah, and Cindy. Cindy, I told you that we're gonna do something, because I really will want the whole community to listen to this. And these conversations are really critical for us to have, and really in a safe space where we can have honest chat about experiences and everything, and build the community. Also want to thank the CDI, the MGH Equity Office, and the Radiology Diversity and Inclusion for all the support in this program. And for everyone, always thank you for coming and joining us here.